You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, board-certified in implant dentistry, Dr. Matthew Holtan. Dr. Holtan,
thanks for having me again, Randy. Glad to be here.
Now, I know you brought a lot of photos, so we'll get to as many of those as possible. Okay. But for people that don't know your practice, I guess all you do is focus on dental implants.
Right. Randy, we're implant dentists. So the focus of our practice is helping people that are suffering with either having no teeth and they're wearing dentures, or they're about to lose some teeth. And as you know, there's many different options which how people can replace the teeth. And it really, it's my job to help guide them in their decisions. You know, are we going to do implants and teeth in a day, or are we going to just replace a single missing tooth in the back?
But you really are doing teeth in the same day, or is also you say teeth tomorrow?
Right.
Is that possible?
Absolutely. There's a couple different ways that things work, but the goal of our practice, and for people that are, again, either wearing a denture or they're maybe about to be wearing a denture.
Like headed to denture.
Headed to dentures is to provide them with a fixated set of teeth in one visit. Okay, and that may mean they're having some teeth removed and we're replacing them with implants the same day. So when people come to us, they're really looking for options. And if they're wearing a denture, or if they're about to lose a couple remaining teeth, my goal is to get them into a fixated solution that never involves wearing a denture. And that can be accomplished in a multitude of different ways. There's some people that we're able to provide them with a provisional set of teeth that they'll wear for 12 or 14 weeks. There's other people that I can have them treated and the next day provide them with a permanent set of teeth. It really kind of depends on the patient's condition, what they want, what their schedule looks like.
So they get a full arch of teeth on the upper and the lower, supported by dental implants. And now you have a system to where, because there's a lot, look, I've had that dentist on the show. Right. A lot of guys doing snap in, snap out. And I'm not an expert. They make it sound pretty good. You don't like the snap in, snap out.
Well,
why?
Again, snap in, snap out is an option. The problem with that is they're still wearing a denture. And I think people come to see me because they don't want to wear a denture. I know that I can keep people happy 100% of the time when they have teeth that stay in their mouth, just like they did when they were 17 or 18 years old. As soon as you fall back to having something removable, it's a psychological thing where, you know, those teeth, they're still not really theirs. And because they come in and out, there's some componentry that wears out. The teeth are more prone to breakage. And Randy, I just feel like in today's modern era, nobody should be wearing removable teeth. And if I have a solution that works, that I can accomplish in 1 or 2 days, then why wouldn't I try to promote that to everyone if I know it's better?
Now you say, and we're talking in the green room, that every day changing people's lives. You believe that?
Right, absolutely. Randy, people tell me it changed their life. And when they come back with their stories about how it changed the way they interact with their family and their friends, and how they're able to go to restaurants and eat the things they used to eat, this is not just a functional solution for people. This is an all-encompassing change of life, and it's a transformation.
And they can eat really whatever they want?
They can eat anything that they want to eat. These teeth, especially with some of the newer options that we have, like zirconium, I tell people, I think these are lifetime solutions for them.
Okay. I mean, they could eat like nuts, like raw things, like raw broccoli, a carrot with their front teeth?
Anything that they want to eat, they can eat. Now, like anything, there are some restrictions that I'd like to think would just make sense, like chewing ice and things like that. But for the most part, these teeth are more durable than the teeth that they're replacing or may have had years ago. I know how their teeth are going to look. I can already picture how I'd like their teeth to, say, follow their lip line a little nicer. Their teeth weren't showing as their denture moved up. I can reestablish proper dimensions, fill their face out, and that is really where the rubber hits the road with this stuff. It's not just a procedure. It's not just a case. It's what does this person want? How am I going to be able to deliver it efficiently for them? And again, at the end of the road, people don't want implants. They want teeth that work and that look
that
really
don't
nice.
Come in and out.
That don't come in and out of their mouth.
So no snap in, snap out.
It's not
That's
that
your opinion.
It's not that it can't be done.
Okay.
And there are some people that prefer those types of methods, and we can do them. When I know something is better, I'd like to talk about that, and that's certainly where I try to.
Look, I don't want to put you on the defensive, and I know you want to be positive, but I told you, I have dentists that say, I don't think it could be done in 1 day.
Yep. All I can tell them is that it can. And
is it because of experience? That's based on their experience?
Well, don't forget, Randy, this is something that we're doing every day. Okay, and we have a lot of experience doing and working with these types of people. Again, we talk about traveling to learn this stuff. It's not that doing it in one day is just better for me. Again, it's all about the patient. If I can tell someone they only have to go through one procedure one time, as opposed to going multiple places
good,
and having it done multiple ways, I just think it's better.
Okay, good. Now, you brought some photos. What are we looking at?
I brought a bunch of photos. Again, there's lots of people that we've helped. It's hard to find the ones that we just want to show. This is a really nice gentleman who came to me who hadn't seen a dentist in years and years. And what you find with a lot of these folks is that they're super high fear of the unknown. They don't know if someone's going to tell them they have to have a denture. They've talked to their parents or relatives that had one and struggle with it for years. So when they come to visit me,
they've seen you on TV a lot.
They've seen me on TV. They've seen you, and in one simple consultation visit, that again is a no-fee consultation, we'll take a free radiograph of some sorts to give me a picture of where everything is, and I can tell them that yes, I can do it. This is what it would cost. And again, all they want to hear about is the benefits. You know, what is this going to look like and things like that. And
so this guy right here, like these teeth I'm looking at, those teeth had to go?
Randy, this gentleman was headed for a denture. He didn't want one. The reason he was hanging on to those last couple teeth is because he knew what that was like, and he didn't know how much worse a denture could be. So we were able to treat him. We were able to comfortably relax him with sedation in the office. One simple procedure, and he left the office that day with a fixed.
Let's take a look.
With a fixed set of teeth, and you can see what he looks like. You can just see it. You know, look at his eyes. Look at his smile. He's showing more teeth there, and certainly he's happy with the result. Every time he comes in, he thinks we did the greatest job in the world. Randy, when you look at the before and after side by side, you know it doesn't take a dentist to see that there's problems with the teeth. He's maybe not happy with his smile. He's not comfortable, you know, really showing everything he has. And when you look at him after, I mean, this is a good-looking guy. And
it does add to the attractiveness.
It adds to the attractiveness, the appeal, and certainly he's more confident going in public and doing the same things that we like to do. I have another gal here. This lady came to me after going and searching out multiple different other types of dental specialists who all told her there was only one way to have it done, and that she had to have her teeth removed, she had to wear a denture for 6 months to a year, she had to have costly, expensive, and painful bone grafts. And she came to me after going through that and really didn't believe I could do what I said. And
like in one day?
Like in one day.
Because they saw you on TV and they come in skeptical still.
Yep.
Is that right?
Comfortably relaxed with sedation, teeth out, implants in, fixed teeth the second day. If you see her after results, this is just one of the most transformative people I've been able to help. She just lights up. Gorgeous smile, just a wonderful change for someone that, you know, is certainly more healthy as well. This gentleman here, as you can see, younger guy, lots of teeth problems. Again, didn't know what to do. Where do I go?
So he was headed for dentures.
He was headed for dentures. He actually saw one of our previous programs. He saw some of the things that we were able to do. Again, same thing. Can it be me? Can you help me like you've helped those other people? And we were able to comfortably relax him with IV sedation, and all the work was done in one day. If you can see from the final, you know, again, we talk about pretty smiles, transformation, the way he lives. Honestly, for this gentleman, I think the most important benefit is he was able to eat again. And he's a strong guy, he works out every day. He kept telling me, he says, you know, I haven't been able to eat any of the stuff that I want to eat in years because I just had another tooth problem, another this, another that. And I was so afraid of what dentures would be like.
I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, Randy, a lot of people have just adapted. And don't forget, they don't even know that this is an opportunity for them. Their dentist may not have talked about dental implants or talked about another solution. So if that's all that they thought dentistry could offer them, that's what they're willing to deal with. And how do they know that there's not a better solution, that feels better, that looks better?
So denture wearers don't go to the dentist, number one, right? So
most denture wearers have been forgotten by dentistry. They don't go back to see the dentist anymore.
No reason, right?
And they don't think there's another solution.
We have time for a few more photos.
Absolutely. Randy, this beautiful lady is a former dental assistant, and she came to me and she'd seen some of our program stuff. She'd looked me up on the internet, and she was sick and tired of having all her dentistry fail. She had some beautiful crowns done years and years ago. She had begun to lose some of the back teeth, and now the tipping point was a nice bridge that was relatively recently done was lost. And again, oh my gosh, I'm a dental assistant. I heard people complain about dentures when I worked in practices. Is that what I have to do? Is that the only place I can go? So Randy, here's her final picture. And as you can see, you have no idea that those aren't veneers or someone did a nice job with crowns. They look natural, although they are white and they're pretty. And I think for someone like her, if you put her before and after up next to each other, don't tell me she doesn't look 15 years younger.
Yeah, well, so she looks more attractive for sure.
She looks definitely more attractive, and you can see it in her smile. She's a really beautiful lady. Randy, do I have time for one more?
Sure, one more.
So this is a really nice gal, Beverly. She came to me because her son works in dentistry, and he had told her, Mom, dentures are not for you. It's something we want to stay away from. She was losing some teeth. They become to be a little loose, and I was able to treat her with fixed teeth in a day, as you can see here. She was blown away that the process could be done in one day, that she didn't have to wear a denture even in the interim, and that the teeth looked and felt better than the teeth she had before. So she immediately resumed all her old eating habits. She never missed a day off hanging out with her friends and things. And I think it really changed her life. And you can see that she had actually told me she wanted to be included in your program because she wanted other people to know that even at 75 years old, this was something that she couldn't have done without. So people come to me all the time and ask me, Dr. Holtan, am I too old for this? Have you helped someone that's older than me?
How old can you be?
People can be as old as they can be.
Like your oldest patient?
Into their 90s.
Really?
Absolutely.
Why would they want to do this?
Well, the question is, why would you not want to do it? If you're 90 years old and all of a sudden you lose all your ability to chew, to smile, to go out in public and do those things, are you willing to give that up? And, again, it's a decision for people to make, but I think the decision is relatively clear.
Now, we should mention, because we get a lot of emails about this. Now, Medicare, Medicaid does not cover dental implants here in the U.S.
Right.
And most insurance, even if you have the best insurance, doesn't cover the whole procedure.
Yeah. Unfortunately, insurance wasn't really created to help people solve these types of larger problems. So one of the things that we've been able to do to help a lot of people is provide in-office financing. And like I tell people, if there's a way that we can make this work for you, I'll always be willing to do it, because you see, obviously, the types of things it can help people with.
Final message, somebody watching this, they're still skeptical.
What I would do is I'd invite them to come in and meet us and come for a free consultation. In one simple 30-minute visit, I can give them ideas about, if I can help them, what it would cost, time frames and things, and then we, just get the conversation started.
Okay, good. I want to thank you for coming on the show.
Hey,
Always
thanks,
a pleasure.
Randy.
Thanks for coming back. You've been watching The Wellness Hour. We'll be right back. You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have Florida's dental implant dentist, Dr. Art Molzan.
All right, Randy.
Welcome to the program. Welcome back, I should say.
Thank you for inviting me back. I'm excited.
Now, in fact, I probably interviewed you for the first time how many years ago?
Oh boy, I think somewhere around 5.
So
I believe 5 years ago.
So you've helped like thousands of people.
Yes, we have.
Since then. Now, for people that don't know your center, okay, because I guess your focus is implant dentistry.
Correct.
Who's coming in now for this procedure?
There's a variety of different folks that show up for treatment. Basically, the new care that we're offering is dealing with more full mouth dentistry than we have in the past. We have the ability to do a single tooth. If someone had their front tooth broken off, we can replace it with an implant and a tooth the very same day. But more and more and more, the opportunities and the advancements in the game are that we've been able to help people who have really bad teeth and need an answer and need an answer pretty quick. Basically, we have 2 categories. We have folks who've lost their teeth and have removable teeth that aren't working.
Dentures.
And I believe there's like 50 million people in the U.S. alone that are suffering from that problem. The bigger part of the group are people who have bad teeth, people who have infections in their mouth, either due to failing teeth or due to gum problems. And we can help them now with dental implants, remove the infection, make their mouth healthy, eliminate or minimize rather, the cause of heart attacks, strokes, diabetes, and cancers, because the infection goes out of their system.
Okay, now, you have a concept where you do everything under one roof.
Correct.
And you do it in the same day.
Yes.
Is that?
Yeah, and that's the unique part, and most people don't believe it can happen. We have
like the people
come in,
that see you on TV, they come in and what do they say?
Yeah, they come in and go, no, there's no way this can happen. And a lot of times my dentist said this can't happen. And we have to just take the time to explain that we have the opportunity that you can have one doctor in charge of your whole care, walk you from start to finish, remove teeth, place implants, give you teeth the very same day, and out the door you go.
And fixed teeth. That means a
fixed
full arch
teeth.
of teeth that don't come in and out?
Correct.
Because
And
you don't
that's
like
the
the
magic.
snap in, snap out?
Well, it's not, they're good, but they're still dentures. That's the problem. They require a lot more time in the dental office, a lot more adjustments. Removable teeth are still dentures. Permanent fixed teeth are the answer. And that's what people want. People want to get back to normal. Removable teeth, snap-in dentures are still not normal. They're not the normal thing.
One of the things you said in the green room, you said teeth tomorrow.
Teeth tomorrow.
So somebody watching this could have teeth tomorrow.
Correct. Our concept is basically teeth in a day, where we can go ahead and do the treatment, slip the teeth out, drop the implants in, give you teeth, and now that some of these newer concepts, we can have the final teeth within a day. So there's some really exciting things going on in the game
People
today.
can walk in, no teeth, and they can walk out with permanent teeth that are coming in and out.
Correct.
Is that right?
Yes.
Does that happen often or every once in a while?
It happens all the time. All the time. And again, one of the problems we see is that people come in and they don't believe it, and they've had others say that it's not possible.
They don't believe it even when they come in?
They don't believe it. And again, many have come in where the only offer they've had is for removable teeth, whether it be on implants or not on implants, a denture or a denture on top of implants. And they don't have to have that, but they've been told that's the only way to go. And many times that's not the case. So if someone's been told that they have to have removable teeth, I'd
You
like
mean
them
snap
to
in, snap out.
in. Yeah, I'd like them to stop in and talk to us, because there is no way that they have to have that. I don't believe we have found a patient in the last 3 years that we have not been able to provide permanent fixed teeth. It's just there are techniques and things available to make that happen.
Okay, good. Now you brought some photos. What
I
are we
did.
looking at?
All right.
And you say, by the way, that it is life-changing for these people.
I think it's going to be. I think it is. Not going to be, it is.
I mean, they tell you that.
Yes. So we have Joy.
All right.
Joy is one of my ultimately favorite patients. She works down the street. She manages and runs the local car wash. She had lost a tooth, could no longer wear her removable teeth, couldn't chew, couldn't function. So here we go. We've got a gal who's living life, has a long life ahead of her in this instance, and can't function, only has a couple teeth left. And the one thing she didn't want was a denture. She didn't want a big clunky denture in her mouth that she had to put in a glass every night. So we talked about it, and for Joy, we were able to do it in one day, top and bottom in her case, and it worked fabulous. It changed her life. Randy, I'd like you to look at this side by side. The difference for Joy, this is the life-changing conversation that we just had. She's completely changed in her perspective on how she is approached and how she's looked upon by other people in the community.
It is true. I mean, when I look at this, in the after, she looks more sophisticated, younger, healthier.
Correct. And many people, because of their teeth, they've been viewed as kind of lower level folks, and that is not the case. But when you give them that smile, not only do they get interpreted differently, but they feel differently about it, and that's communicated. They just feel better, more confident.
When you say things like people with bad teeth are discriminated against, what do you mean by that?
Well, it's just like in the movies. If you want a character to look like they're from the low end of town, they pull a couple teeth on them and have them look like that. If they're a villain, they darken their teeth to make them look evil looking.
Good point. Okay.
So there's many times that the teeth are representative of your presentation to the world. And even the movies know that, because they start doing things like that to
Wow.
evil eyes or to make people look lower level and things like that. So that's been part of our common thread through society. So when you give someone a beautiful smile, people just view you differently.
So this woman in particular, so she couldn't eat. With those new teeth, she can eat what?
Anything.
Like
it's like getting normal
ribs?
teeth back.
Can she eat nuts?
Yep. Ribs,
Popcorn?
nuts, everything.
Doesn't
Yep.
matter?
Doesn't matter.
So you have more photos. What
I
else
have
are we
more.
looking at?
Okay. Harry's a fellow who had some issues on his top teeth, had some infections, and had some loss. Harry's the most social guy you could ever imagine. And he's just a talker, and no way in the world would he be satisfied with an upper removable denture. So the teeth were removed, infection removed, implants placed, and permanent teeth placed. So again, for Harry, I think it was absolutely essential. He was referred by a dentist friend in town to have the work done, And for Harry, it's essential, being as social as that fella is and as talkative as he is, to have teeth that behave and function like normal teeth.
So those teeth that I'm looking on the before, those had to come out.
Had to come out.
Couldn't save those.
Yeah, you can see on the picture the teeth, there's a little space between the front teeth because the teeth were spreading out. They were losing the strength of the foundation. The foundation was given out. And so in this instance, there wasn't enough there to save, so we ended up slipping them out, dropping the implants in, and going to the teeth in a day concept. And the beauty of that is that it's all accomplished in one visit, in one day. They get their teeth.
There are many offices that, and they're here on the show, they say, Randy, the right way to do this, the careful way, the prudent way to do it, is to put the implants in and wait for 6 months or 8 months. I just heard that the other day from a dentist. When you hear that, is that just older thinking?
Well,
older techniques?
There's, the analogy I tend to use with this, and I'm not sure it's the best one, but there's a couple different ways to get to China. You can take a slow boat to China, and there's nothing wrong with that. There's nothing wrong with that. You'll get there. You can also take a plane and be there. So the teeth in a day concept is getting there in a day, and you can do that. And modern dentistry that concept is available. There's a lot of clinicians that, based on their training, they're just not comfortable.
You teach other guys this?
Oh yeah, yeah.
So you teach them this concept of teeth in the day?
Well, because it's considered relatively new, even though we've been doing it for, oh goodness gracious, now at least 15 years.
I mean, you've done thousands of these.
Yes.
Is that right?
Yeah, so it works. That's the bottom line.
How old can you be to do this?
That's great. Well, that'll probably come out in one of these other pictures as
Let's take a look. Let's take a look.
Let me pick this one, because this one is a favorite.
All right.
All right, this is Virginia. Okay, had front teeth and the bridge broke. The teeth broke off. Teeth were non-fixable, not usable. In her 80s, all right? Did not want a denture, did not want removable teeth, didn't want to go through the balance of her life with removable teeth that go in a glass at night. Okay, so with her in her 80s, she wanted the solution right away. She did not want to wait 6 months like you just described to me, where she has to wear a denture over the top of these things. You just don't have to do it. And so for her, we were able to do the same concept: slip the teeth out, drop the implants in, and give her teeth that day.
So full arch of teeth, they don't come in and out.
Nope, they go in that day and they're in. And in her case, one of the fascinating aspects of it is there's so little associated discomfort because we're doing everything at one time, and there's no denture sitting on the gums making things sore, rubbing and things, that she left within 7 days and went back north for the holidays. And so in our practices, we see a lot of snowbirds where folks come down for the 6 months during the winter where we have the really nice weather and go back up. So we're dealing with folks all the time that are not full-time in our community, that are part-time there and part-time there, and she's the best example.
How soon can you eat? If everything goes well?
Well, if you're taking someone, and we'll go through it on one of these next patients, if we don't take teeth out, you can eat that day. Now, if we're taking teeth out, we put you on a soft diet for 2 weeks, because you've got the extraction sites, the holes where the teeth came out, and you don't want stuff to get in there. So for that. But the magic is the teeth are supported by the implants that day, not resting on the gums. They feel and function. And you could chew on them, yes. We ask you not to.
You've been doing it a long time. Are the patients getting younger and younger that are doing this, or older and older?
Well, it's a total mix. There are people with bad teeth in every age group.
All right.
All right. We have 80 years old. I think the oldest that we've worked with an all-on-4 type of case where teeth today, I believe she was 87 years old when we performed the case. And I believe the youngest probably was one of Matt's patients. I think she was in her 20s by the time she had the treatment done. So dental disease, dental problems, bad teeth can happen at any age. And it's a matter of when it's the right time, because many people are lost. They don't know what to do. Their teeth are falling apart, they're having problems, and they don't know what to do.
So they don't know their options.
They don't know their options.
So when they come in, they're pretty surprised.
Yes.
Yes. And what's their number one question?
Well, part of it is our communication process, like this program, where we reach out to people and let them know there's an answer. There's an answer out there for them. And so the number one thing they come in is, number one is, can I have it done?
I mean, this looks cosmetic, and I'm not trying to side with you, but I feel like I could spot a denture walking down the street. I mean, when I look at this, so in the design, you play a role in the design.
Correct.
To fit the teeth to their face or whatever.
Yeah, the magic is in the smile. People don't want dental implants. What folks want to do is have a healthy mouth, a pretty smile, and be able to chew food. That's what they want. They don't want dental implants. They don't want the teeth that go on top of them. They want the smile. They want to be able to chew. They want to feel like it's part of their body, and it is. Do you have time for one more?
Yes.
All right.
Got
Here's
about a minute.
Joe. This is one, and it's an absolutely fantastic case in regard to had removable teeth. Had them for a long, long time. Had a new set made. Didn't like them. Weren't working. He wanted something better. He's up in age.
He had false teeth before.
Had false teeth
Okay.
before, okay? And the interesting part here is as we all mature through life, we all start having health issues. So I have patients coming in every day saying, well, I'm a diabetic, I'm a thing. Joe had lots of those problems. He had the blood pressure, had the diabetes, had the blood thinners, all the stuff, and we were still able to give him implants and teeth in one day.
And
It's just
most of these
amazing.
people are sedated? Lightly sedated?
Well, it depends on the patient. We
Okay.
could do it without sedation, but the vast majority would rather not know about the experience and would rather kind of be zonked out as we go through the process. But with Joe, one of the interesting parts was that he wanted this. He didn't know about it, just like we had talked earlier. But the magic kind of came when we were able to help him finance and get some payments that worked within his budget so he could afford to have this done.
Because Medicare, we should mention, Medicare, Medicaid, even the best insurance does not cover the implant procedure entirely.
Correct.
And with Medicare, Medicaid at all, so
Yeah.
you have financing.
We have financing, and that it's almost that's not essential for every patient, but bringing it into a monthly payment program
Okay.
has helped probably the vast majority of the patients in our practice.
So no more dentures. You have,
No more
let's get
dentures.
that one in 30 seconds.
Last one, 30 seconds. Okay, a smile, bad teeth, shows up. The issue for her was had some infection, swelled up into her eye. Okay, so we got the infection under control. The teeth weren't keeping.
You couldn't save them.
Couldn't save them. She wanted a beautiful smile, and if you look at that pre-picture,
nice.
so then when you flip over to the final picture, she has the smile she's always dreamed about. She's infection-free.
I mean, it looks like real teeth, actually.
And the magic is, look at the eyes. The eyes are the giveaway. I mean, the eyes, they just light up.
She does not look like the same person.
No.
I think anybody would agree with that.
No,
Much-
it's
added
eye-
to her attractiveness for sure.
I think it's the eyes. I mean, you can just tell
Yeah,
she
you can.
feels different about herself, more complete.
All right, we're out of time. Final message.
Okay.
Somebody watching this, they're still skeptical. They're going, I don't know. What do you say to them?
Well, come on and see us. I mean, that's the essence is go see someone who knows what they're doing and can help you.
You believe
That's
they should be board certified?
I believe that's the best person to do it. It doesn't mean that others can't do it very, very well. But if you're only going to have it done once and it doesn't cost any more to work with someone board certified, I don't see why you wouldn't take that advantage.
Okay, good. I want to thank you for coming on the show. Always a pleasure to have you on the
All right,
program.
Randy. Thank you. It was great.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.